Hi, everyone, and welcome to another episode of Beyond Wellness with Face Ben. Today, we are going to be discussing a very important topic that affects women mostly and is about cervical cancer and breast cancer. Today, I have with me a specialist in this field, Nurse Agnes Karatu, and she is a specialist of cervical cancer and breast cancer. Welcome, ma'am. I'm so happy to have you.
Welcome, thank you.
Okay, this is a topic that affects mostly the women. I want you to give us a general preview of everything. I don't know where you're going to start from, maybe the breast cancer or cervical cancer, but we really want to be enlightened on this cervical and breast cancer. Thank you, ma'am.
Thank you very much. You're welcome. It's being here today to discuss on this very important topic. I believe this is an avenue that will still give more awareness and educate people out there so that they will get screened. We'll start talking about cervical cancer. Cervical cancer is the cancer that's affecting just women because it's affecting the cervix. The cervical cancer is a cancer of the cervix. The cervix is the opening of the womb in a woman, and only women have this cervix. So the cancer is predominantly just affecting women. Cervical cancer is the second most common cancer affecting women worldwide, and in Nigeria inclusive. Cervical cancer has a cause. The cause of the cancer is HPV virus. So this HPV virus, a woman can get infected with HPV virus through sexual intercourse. Once a woman is sexually active, she can be infected with HPV virus. And this HPV virus, in a normal situation, the body immunity normally fights this virus. But in a case whereby the body immunity is not successful in fighting this virus, we have a period of progression where this cancer, where the HPV infection persists. And after persistence of the HPV virus, that is where it will lead to a stage of pre-cancer, and now a woman can come up with cancer. The cervical cancer is preventable. Why we are creating awareness to women is because this cancer can be avoided. Death due to cervical cancer can be avoided. How? We have primary, secondary, and tertiary prevention. These are the modes how we can prevent the cervical cancer. In primary prevention of the cervical cancer, we have health education, whereby if we talk about it, we educate women to know that there is HPV infection that can lead to cervical cancer, and we create awareness for people to come and get screened. We also advocate for vaccination. The vaccine normally is given to children within teenage children within the age of 9 to 14, and when this shot is given, the body immunity is triggered and will prevent against HPV infection. But in a situation whereby a lady or a woman is sexually active and has not gotten the shot of the vaccine, there is a need for screening. Woman is expected to be screening after every 3 years. Some countries advocate for 5 years, but here in Nigeria we adopt screening for 3 years. After every 3 years, a woman is expected to come and screen for cervical cancer, so that this cancer will be detected early. If the cancer is detected early, it's 99% curable. She will be treated and she will be free at the precancerous lesion. She will not develop cancer. And in a situation whereby the woman is not fortunate to get screened, or she came for screening at a late stage whereby she is already having invasive cancer, then treatment will commence at the early stage to avoid the burden of screening and to prevent death due to cancer.
Thank you. Okay, thank you so much, ma'am. So, ma'am, what about cervical cancer? Is there anything men have to do to help their women prevent this cancer?
Thank you. The involvement of men in this prevention of cervical cancer is children, also male children, can also be immunized with the HPV vaccine. But when the vaccine came in, due to number, the vaccine will not go around both female and male, and the burden of the disease is female. That is why only female will have vaccine. But male can also be vaccinated. When boys are vaccinated, it's now part of the issue of transmission of the cancer. And in adult men, we have the risk factors of this cervical cancer. We are talking about multiple sexual partners. When a man sleeps with this lady, he transfers this to this, he gets this from this and transfer this. When we now advocate men should abstain from multiple sexual partners and stick to just women. And also, men can also go for investigation when they have any infection, so that they will be treated to prevent occurrence or persistence of this infection in their system and subsequent transmitting it to other females that will now develop cancer.
Okay, thank you so much, Mary. So if you're a man out there, please avoid multiple sexual partners so that your wife can be safe and prevented from cervical cancer. Ma, so the screening method, is there any procedure? Is there pain, or is there maybe some women who feel like I don't want to go through the stress of this? Is it a stressful process?
No, the screening, we have modalities of screening that we do. We have the VIP, that's the visual inspection with acetic acid. We have the visual inspection with sulfurs and iodine. We have the pap smear test. We have the HPV DNA testing. We also have the biopsy, colposcopy biopsy. So during this screening, it's not a stressful test because we are not going to give you injection, we are not going to cut you, no pricking, no nothing. What we use is a disposable plastic speculum where a woman will lie down and it will be inserted through the vagina. Then we'll now open the speculum so that we'll be able to visualize the cervix, and we just spray this reagent so that we see the reaction whether it is positive or it is negative. And all through the screening doesn't take more than 5 minutes. It's not painful, but normally some women normally feel little discomfort or cramp. But the screening is not painful. It's not stressful.
Okay. Nothing should stop you as a woman for going to check for cervical cancer screening. Moving to the next, we want to know about the breast cancer.
Breast cancer globally is the first most common cancer affecting women for everyone. Unlike the cervical cancer that is preventable, but we have vaccines, we have screening. In breast cancer, normally when it normally just comes up. So what you will do to help prevent this breast cancer is continuous breast examination, so that you will detect any lump that has not become cancerous. This lump can be removed to prevent cancer. And if there is cancer that is just starting at an early stage, so that it can be detected early and be treated to lessen the burden or prevent the death from cancer. So breast cancer is also another cancer that is affecting only women. How do we prevent breast cancer? We do so by routine breast examination. During this breast examination, it's not even expected that a woman should be coming to the hospital on monthly basis for breast examination. Every woman can do breast examination on her own, in her bathroom or in her bedroom on a monthly basis. And how do we do this breast examination? It is expected a woman examine her breast monthly. We advise that this breast examination should be done after the menstrual cycle, maybe after the woman just finished menstruating. So the last day of her menstruating, the next day she just pick that day. But in a situation whereby some women are on family planning that they don't see period, some women are menopausal already, they are not menstruating, so you just pick a date. It can be on the 5th, on the 10th, on the 11th, any date you pick, cycle it on your calendar, and that will be the date that every month when it comes, you examine yourself. How do we do this self-breast examination to prevent breast cancer? A woman will have to remove her clothes where it's comfortable for her. It can be in her bathroom if she have a mirror in the bathroom. She can do it maybe after taking her bath or before going to take her bath in her bedroom. If she has a mirror, we expect she remove her clothes upward like this. Maybe just remove her top. There is no bra. So that first step is the self-breast inspection. You remove the clothes, you stand facing the mirror, you observe the breast. In normal situation, normally the breast, the size are not always the same thing. There are odd in some women, you find out that one of the breasts is like slightly bigger than the other, but not much different. That one is normal. So a woman will remove her clothes, she will inspect the color of the skin of the breast, she will check her nipple. Normally the nipple is that dark area at the tip of the breast. She will check is darker than, she will check the color of the skin of her breast with her skin color. If there is any changes, there is a cause for alarm, that is when she's expected to come to the hospital. And after that, can I demonstrate?
Yes, ma'am. Sure.
The examination can be done two ways, either standing or lying down. If you are standing, you stand straight. If you are examining the left breast, so your left hand will be at the back of your head. Keep it like this so that it will be well, the armpit will be well open, because the lobe of the breast goes even to the armpit. So you will use the palm of your hand, place it upward like this, and you press it deep into the breast so that you feel what is underneath, so that you will not go and just be palpating your skin, but you palpate to know what is underneath the skin. You palpate it all through. You are not having clothes on you, so there will be no obstruction. Your hand will go through. That is how you palpate it all around to the nipple, and you now press the nipple and see if there is any discharge, any water, how the color of the water, that the fluid that is coming out, is it watery, is it yellowish, is it white, is it bloody? If it is just watery or just white, which is normal, you now see that small fluid from time to time, whether you are breastfeeding or not. But it's not normal when you see a blood, or the color is somehow, or if it is a pus, that is a discharge that is not there. There is no need for it to be there. That is when you are expected to report to the hospital. And during palpating, when you are pressing it, you now feel, normally there are lobes, you will feel something in the breast, which is normal. But when you feel it's hard, like a stone or like a seed of granite in it, that's, we call that a lump. It can be cancerous, and it may be there, but it's not cancer. But leaving it there is not safe. So anytime you are doing breast examination and you feel that, no matter how small it is, because normally it starts very small, and you leave it there, it continues growing, and normally there is no pain. So if you leave it there, by the time you have started feeling pain, it has become something else. So we are expecting, when you feel anything like that in the breast, not the normal loops that are in the breast that you feel, but you feel something very hard, no matter how small it, we expect you to come to the hospital for further evaluation and management. Doing this monthly, definitely you are going to prevent yourself from breast cancer. Thank you.
Okay, ma'am. When a man sucks a woman's breast, does it also affect or contribute to breast cancer?
In fact, we advocate that women should breastfeed frequently, because that will also help prevent cancer. So sucking breast doesn't cause cancer.
So too much of it or less of it does not?
Less of it is a predisposing factor, but not a cause.
And discover that she has any of these symptoms. So what is her next line of action?
After self-breast examination at home, and you feel there are changes that taking with, so expect it for the breast eye. What we do at home is manual self-breast examination. We now use this instrument to also do the self-breast examination. If there is any change or any abnormality in the breast, this instrument dictates it for us. And if there is needs, we will now send you. Also, we have another thing that we do, the breast scan, the mammograph. These are all investigations we do to dictate any change or any abnormality, whether cancer or not cancer, in the breast.
Okay, thank you so much, ma'am. Okay, lastly, before we go, ma, I want you to tell us your general advice for women on this breast and cervical cancer for them. What is their line of action?
Okay, I'm calling out to women today. Every woman needs to stay healthy. Every woman needs to live a life healthy. We don't want a woman to come up with breast cancer or cervical cancer. So what we are advocating for today, make sure that you do your self-breast examination monthly. And anytime you detect any change, make sure you come to the hospital. If there's any problem, we normally link you up with the doctors where further treatment will start early to prevent breast cancer. And we also call on women today. The cervical cancer screening is free, it's not painful. Every woman needs to get screened after every 3 years, where you walk in, not take more than 10 minutes, you'll be screened and you see people happy. And if there is any problem, we tackle it in time. And we also call on our mothers to also talk to our girls out there to go for the vaccination. Take those teenage girls to vaccination. People have been saying negative things about the vaccine. The vaccine is safe. The vaccine can prevent our children from coming up with cervical cancer. So I hope that women out there will hear our cry this time that we are speaking to them and rush to the facility so that they will get screened and they will continue to do their self-breast examination monthly at home.
Thank you so much. So, if you're a woman out there, we are calling on you to prevent this cervical and breast cancer. Women are dying and we need to prevent women death. Thank you so much. Don't forget to like, share, and comment on this post. So I come your way next time. Bye.